We are just coming out of a fantastic panel organized by PMNCH and partners on Lives in Balance, Accelerating Action for Adolescent Health and Well-Being. And I would like to ask Bhavya Nandini about the key messages of this panel.
So, the key messages of this panel are associated with adolescent health and well-being as the broader issue that we were addressing as a part of this event. Some of the key messages that emerged was that evidence doesn't do enough just on its own. The evidence is compelling, it's robust, we're getting better at it, but it needs to reflect community realities. It needs to be adaptable to the national context, and it is only then that it will work for the adolescents in different regions and countries. The second key message that came through was that we need more young people contributing in decision making, in decision making rooms, taking decisions, helping with sharing their realities so that policies and programs reflect and are able to take into account those realities and address those needs as required. And the third very critical key message that came through from philanthropies and from donors is that we should not be looking at ODA as just something that is never ending. It should not be used as a substitute. It should be used as a tool to ensure that national health systems, national systems in general, are strengthened and capacitated to address adolescent health and well-being needs. And the fourth most important thing that came up was that at the national level, we need capacities of people who are dealing with adolescents. We also need young people who are dealing with adolescents, because there is a certain amount of comfort that young people have when they are talking to people of their own age. So when it comes to accessing information, services, non-judgmental information and services, it is when they are talking to somebody who is their age. So addressing stigma is very important, but also making sure that they're not going to other means and channels of information that may give them the wrong information is required.
And one of the interesting aspects was that we heard from countries, and we learned from countries like Sweden and Nepal that how, for example, abortion law changes and decriminalization helped adolescent access to services and enabled. However, we are seeing new trends due to the anti-rights movement. For example, the High Court in Kenya just criminalized a 17 years old survivor of rape and the provider of providing services. Cross-country collaboration and cross-country collaboration for holding each other accountable came up. How do you work on these aspects to helping countries to communicate good practices with each other?
So I think there are two very critical mediums for that. One is global platforms like this one, where we bring together stakeholders from different countries that have seen success. We had the DDG of, from South Africa, who was mentioning how good practices can be shared and how they must be shared about what is working, what has seen progress, where has there been a challenge in implementation. So it is through these particular platforms, whether it is an event like Lives in the Balance or even global platforms like the WHA, where this exchange and transfer of knowledge can happen. Because when you hear about a country doing well in a certain issue, and in this case adolescent health and well-being, then you can always think about drawing from those experiences. And the second is, of course, the power of partnerships. If there are partnerships that are convening these stakeholders, not just during global events, which can be, say, annually or biannually, but on a regular basis, this flow of information from one country or one nation to another becomes a lot more seamless, and there is more opportunity to learn from each other and to see how two countries or a very large number of countries or a small group of countries can actually work together to address one issue, because at the end of the day, collective action is what is going to make change.
Thank you so much, and congratulations.
Thank you so much.
Great.